Hello viewers, our topic today is coronavirus disease 2019 in children. My name is Dr. Supa Tunje from the Department of Pediatrics and Child Health in Machakos County. I'm also the Treasurer General of Kenya Medical Association. I will give a background to our topic today. Viruses continue to emerge and pose challenges to public health, and some of the examples of the viruses that have emerged include severe acute respiratory syndrome, which came in 2002, and it's known as the SARS-CoV-1. In 2009, we had the H1N1 influenza. In 2012, we had the Middle East Respiratory Syndrome coronavirus, which is commonly known as the MERS-CoV. In 2019, which is the topic of today, we had the novel coronavirus, which is now known as the COVID-19, the SARS-CoV-2 virus. So I'll give a background of coronaviruses. These are a large family of viruses that cause respiratory illness, and they belong to the Coronaviridae family. Named for the crown-like spikes on the surface that you see, and there are 4 subgroups: the alpha, the beta, the gamma, and the delta. They are enveloped viruses with the positive strand, and these are RNA viruses. So I'll go to the SARS-CoV-2, which is a beta coronavirus. The size is about 60 to 140 nanometers. And like just other coronaviruses, it is sensitive to ultraviolet rays and heat, and therefore it's inactivated by heat. It's also inactivated by lipid solvents, including ether, ethanol, and chlorine-containing disinfectants. Amplifying mammalian hosts are the intermediate between the bats and humans. And since the mutation in the original strain, this could have triggered the virulence that occurred in humans. A bit on the etiology of this virus. So SARS-CoV-2 is highly infectious virus, and the main routes of transmission include respiratory droplets, contact with respiratory secretions, and saliva and aerosol particles. There's limited data that's available on the vertical transmission, that is the transmission of the virus from the mother to the fetus. SARS-CoV-2 has not yet been detected in breast milk. However, there are a few studies that are showing some transmission, but this is not yet determined. And family clustering appears to play a major role in the disease transmission, and this you have seen even in our country. The epidemiology of COVID-19, the true incidence actually for children is not known because there's a lack of widespread testing in children, because the priority has been given to testing of adults and children who are hospitalized. But globally, children account for about 10% of all the confirmed cases, with younger than 10 to 14 years less likely to become infected. Hospitalization rates are much lower in children than adults, and children with underlying conditions like obesity, diabetes, asthma, hypertension have been found to have a higher risk of serious illness. Infants, however, these are children less than 1 year, are at higher risk of serious illness due to their immature immunity. Newborns are also at risk of infection if born to mothers who have serious disease at the time of delivery. In Kenya, the data as of end of November, it showed a total case rate of the children who are under 5, about 1,096 children have been infected so far, with about 590 being males and 506 the females. The total deaths as of end of November are 10, and 6 of them male, and 4 of them are female. So I'll take you through the clinical presentation. In children, it has been observed that most of them tend to have a mild form of the disease. And some of the symptoms that have been demonstrated include fever, nasal congestion, and running nose, cough, a sore throat, shortness of breath, or difficulty in breathing, fatigue, headache, muscle aches, nausea and vomiting. There's diarrhea. Some of the children have poor feeding or poor appetite. There's also sense of loss of taste in smell, and some of the children will complain of belly pain, and sometimes you have redness of the eyes, what we commonly call conjunctivitis. So in the clinical spectrum of this disease, most often for children, it will cause the upper respiratory tract infection symptoms, and this may be similar to what we see in the common cold. However, the disease may progress to pneumonia and other lower respiratory tract infections, and this is likely to occur in some of the children with comorbid conditions like the immunocompromised individuals. We have those with diabetes, those with chronic respiratory problems, cardiac conditions, and this is likely to occur in the very young or the children who are older than 10 years of age. There is also a concept of the multi-system inflammatory syndrome, which is coming up as emerging information, and it has been described in the United Kingdom, where children who are previously infected with the coronavirus have been found to demonstrate some signs and symptoms similar to that of Kawasaki-like disease. And there's a description or a definition of this multi-system inflammatory syndrome, and it's available now, and it's undergoing several studies in various countries. And some of the elements of this multi-system inflammatory syndrome include if you have an individual aged below 21 years of age, presenting with fever, laboratory evidence of inflammation, evidence of clinically severe illness requiring hospitalization, with more than 2 organs involved, like the cardiac, renal, respiratory, hematological conditions, gastrointestinal, dermatological, or neurological. And aside from these symptoms, then you have no alternative plausible diagnosis, and you have positive SARS-CoV-2 through the RT-PCR test. Then this will form the criteria for multi-system inflammatory syndrome, and this is undergoing studies globally. So I'll get to the laboratory diagnosis and some of the radiological changes that you may see in children with SARS-CoV-2. And some of the typical findings in children that you may find is a mild abnormalities in the white blood cell count, where you find either increased or decreased lymphocyte count. Then you get mild elevated inflammatory markers like procalcitonin. The other one will be the C-reactive proteins. Then also you have mildly elevated liver enzymes. Some of the radiological findings in children include unilateral or bilateral infiltrates on the chest X-ray, or sometimes you may find this on the CT. A typical presentation would be the ground glass opacification on the CT. However, it is important to note that CT should be used sparingly and only for hospitalized patients with specific clinical indications. So for children, we would like to make sure that we don't unnecessarily expose them to the radiation. Management of COVID-19 in children is mainly supportive care and management of complications. There are no specific drugs that have been approved for the treatment of SARS-CoV-2 as of now. However, there are some of the drugs that have been approved by FDA, which include remdesivir, which has been approved for the use of for treatment of SARS-CoV-2 for children who are above 12 years of age and more than 40 kilos body weight. The safety and effectiveness for those who are below 12 years has not yet been evaluated. Another treatment is dexamethasone, which has been shown to be beneficial for patients with respiratory disease, but the ones who are on mechanical ventilation. However, we know that there are trials that have been done for the children with severe disease and those with other underlying problems. The management of symptoms is basically according to the protocols of respiratory diseases, and in our country, we're using the guidelines and protocols for management of pneumonia and upper respiratory infections. So how can we prevent SARS-CoV-2? So these are some of the measures that have been put in place and have demonstrated significant reduction in the transmission of SARS-CoV-2 in children. And one of these is hand hygiene, where we promote the use of soap and water for washing hands as frequently as possible, use of sanitizers. There's also the use of masks. However, children who are below 2 years may not be recommended to wear masks unless they are in public places and at higher risk of exposure. We have been practicing the social distancing, and this is encouraged for the children to be able to observe the distancing to minimize the exposure from possible contact. Then cough etiquette as one of the measures for those that, especially for the adults who are living among the children, need to make sure that they observe cough etiquette. And a very important method of prevention is vaccination. In vaccination, we have seen a number of trials that are going on now, and we hope that we shall find some of the vaccines even in our country. Already, from the information that we have, is that some of the vaccines are already being administered in some countries. Last but not least, one of the other preventive measures is to isolate the contacts. I'll give a brief of COVID-19 vaccine in relation to children. So we know that vaccines save lives every year. Millions of lives are saved through vaccination. And currently, children are beneficiaries of a number of vaccine antigens against other infectious diseases. And they receive most of these antigens in the first year of life. And subsequently, they receive booster doses in their second year of life. Currently, for COVID-19, we have more than 50 COVID-19 vaccine candidates that are undergoing trials, but already there's data that is showing good information that we have at least 3 of them right now that are showing significant effectiveness. And therefore, we are hoping that this will be available to the greater population. We have a body that is tasked with the mandate to be able to facilitate equitable access of vaccines globally, with the most at risk of infection being prioritized. So in relation to the vaccines, vaccines will be the best preventive measure for this virus, because we know that vaccines have been saving lives for decades. And when a new pathogen or a disease enters our body, it introduces a new antigen. And for every new antigen, our body needs to build a specific antibody that can grab onto the antigen and defeat the pathogen. So as much as we have a number of vaccines that have been available several years in the past, this new virus has posed a challenge, and therefore we hope that once the vaccine is available, then it's going to reduce the incidence of COVID-19 drastically. So I summarize our topic for today, which is coronavirus in children. And this is COVID-19 is a highly infectious disease. There are a number of other coronaviruses that have been circulating. However, SARS-CoV-2 has been a pandemic because it's highly infectious. But the good news is that children below the age of 10 to 14 are less likely to experience severe disease. But it's important to note that infants less than 1 year, because of their immature immunity, may experience a more severe illness. COVID-19 is preventable through the methods that I have mentioned. The vaccine is important to make sure that we reduce the transmission. Several of these vaccines are under trial, and some are already approved for administration to the host. Thank you very much for listening to this topic.